Hello, my name is Dr. Amar bin Sardar and I have been practicing psychiatry for the last 5 years. One of the issue with communication skill is that sometimes the initiation of conversation is difficult. When you enter a room and there are more than 3 or 4 people, you just get stuck and you cannot start the conversation, or you cannot speak or initiate the speech. So that's one of the reason people are afraid of communicating with when there are more than 2 or 3 people. So, and especially what happens that this has been informed by many patients of mine, that there is like their voice gets stuck in this region of their throat and they cannot speak, or sort of their vocal cords get frozen in a way, sort of. So what I have done, and one of the issue is that they feel that we will mess up if we start speech, if we start conversation, we will mess up and they will be judging and what they will be thinking, etc, etc, etc. So there is a big psychopathology, or not psychopathology, I would say psychology behind it, why it happens. But it's the video will be very longer if I do that, so I will just make it very easier for you. If the initiation of conversation is strong, then you can maintain the conversation. If initially if you break the fear, if you break the frozen vocal cords, then continuation of speech is very easy. So what you should do, what you can do is that when you enter a room and you are expected to say something, you are expected to communicate with those people, and you are like, you feel that I cannot initiate conversation. So what you should do is that you should use the word which is just at the tip of your tongue or the tip of your finger. What happens that those words you cannot mess up. If you have been using that word for around like 20 years, 18 years, you cannot mess up, no matter how much panic or fearful you are. And if you try to say anything which you haven't been using for quite a while, then you can mess up those words. So when you initiate the conversation with strength and you break the ice in the throat, then you can maintain a conversation. So for example, I'm a Muslim, so what we do is that whenever we greet people, we say Assalamu alaikum. Or if you are from any other community, you can say any word which is commonly used, like good morning, good afternoon, or namaste, or sasri akal, or any other word which is at the tip of your tongue. So you can never mess it up. So what happens that if you enter a room, you are expected to say something, you are expected to greet them, you greet them with the same, and like slightly louder, even like not very loud, like slightly louder. So what happens that will initiate your conversation, that will initiate your confidence, that will break the shyness in you. So if you enter a room and you say hello, good morning, so what happens that and again, I'm not saying that you should say it everywhere, I'm only saying that when you are expected to say something, okay, you should not say good morning when there's a class teaching going on. That's inappropriate, that's rude. So, and you say good morning, so what happens that then the ice, sort of icing, or the frozen vocal cords, then they start functioning, and then most of the time it's the person can maintain the conversation. And it has always been helpful to many people. Definitely if a person is having very severe social anxiety, social phobia, it will help, but again, it's not cure. And for that there is different strategies, like slightly higher level. But again, for people who have like slight level of shyness or slight level of social anxiety, then it's always helpful. And keep practicing it, and then usually it's helpful. Thank you.